Hey, let's take you back to our main story. And now more than ever, Australians are relying on the country's health professionals as the coronavirus pandemic spreads.
There are fears that the health system won't be able to cope in the coming weeks and months if the case numbers continue to rise. Dr Nick Coatsworth is one of Australia's new Deputy Chief Medical Officers, and he joins us now from Canberra. Good morning, Doctor. Thank you for coming on the program.
Good morning, Lisa.
Hey, can I just ask you, given that you're a new Deputy Medical Officer and we've been hearing from Paul Kelly and Brendan Murphy, have you been brought on and have others been brought on just because of the crisis that we are facing?
Well, I think the magnitude of the crisis, as everybody is saying, is unprecedented. So we do need more firepower. Brendan needs 4 deputies now, not 1. And we need to do that because we've got a variety of different aspects of the health system to cover. So I'm actually a full-time infectious diseases and a respiratory clinician at Canberra Hospital, and I've come over to be Deputy Chief Medical Officer because of experience in disaster response and humanitarian response over the past 2 decades. So we're bringing in, and this is happening in the states and territories, every sort of force multiplier, every bit of human capital that we can possibly have. And I can tell you, Lisa, I've come into the National Incident Room and I'm overwhelmed by the amount of human capital that's actually on this at the moment. It is enormous.
But there's still criticism that we're not moving fast enough. We had Norman Swan on the program earlier saying we've got to ramp up the restrictions on people, that we could have a short and sharp restricted lifestyle, and that could cut the continuing pain that people will feel.
Well, that's a contested point, Lisa, and I have to say that the experts around the table of the Australian Health Protection Principal Committee do not think that this will be over in weeks if you put in harder and faster measures. So this is about degrees. We've gone hard and fast. To say that we've gone light and slow would be completely inaccurate. The measures that we've got in at the moment are unprecedented. The impact they're going to have on individual families is unprecedented. I've got 3 kids. I've got a mum who's got emphysema. I've got a wife who's a respiratory physician, and I've got a sister-in-law who's lost $100,000 because she's a high-level opera performer and her entire annual income's gone. These are unprecedented measures already, and I'm sorry, I disagree with Norman when he thinks that this is going to be over in weeks if we go for harder and faster lockdowns. And I would like Norman to go to Darwin and tell the people of Darwin why they have to stay in their houses when we're a continent and there's differential expression of this virus and its impact across the country. So people can ask for hardest and fastest, but I don't think they've thought through the impact on Australia and Australians of doing that.
We learned this morning that there's another 2 deaths in Victoria, 2 men in their 70s. We need to brace ourselves, don't we, for more deaths and more news like this?
I think we do. I think that we can also, this is the social media pandemic, so we can see the images coming out of Italy, and they are very concerning indeed. So there will be more deaths, but I am absolutely confident, having practiced in this health system since I graduated in 2000, that we are different to Italy. We're different to the United Kingdom, and we're different to the United States. When Italy was at 2,500 cases, as we've just exceeded, they had widespread community transmission already. Their hospitals were already filling. They were only testing people in hospitals, so they had a massive, massive amount under the iceberg. We know that well over 50% of our cases are still travel-related or the contacts of those people who have travelled. Now, because our borders are closed, we're pivoting that testing regime, so there's going to be much more community testing, and within 7 to 10 days we are going to get a picture precisely of what the measures that the PM has announced this week are going to do to the epidemic curve. And every Australian has to be their own policeman and woman now. When we're hurting because of these measures, we're hurting because we need to flatten the curve, and when that curve flattens, every Australian's going to be able to look at it and say, I contributed to that.
Well, Dr Nick Coatsworth, thank you very much for your time. Good luck in this new role.
Thank you, Lisa.
Yes, very strong words there from Nick, and quite robustly disagreeing with how Norman Swan was viewing the situation on the show a bit earlier in the program.
Yeah, and also just picking up on his last point there, suggesting that within 7 to 10 days, we'll know if our social isolating and distancing is having some impact that we're doing now.
Indeed. Okay.